This research project took place in 2014. The research team was myself, Garrett Murian, Yana Khalupkova, Milen Ivanov, and Steven Thompson from Island Life Technologies. And with data collection, we have Steven Thompson, Yana, Maxim, and Milena Sviridov, and Milen. So we have participants from 4 different countries. In this case series, we looked at how delta laser at 980 nanometers can provide benefit to individuals with knee osteoarthritis. We found 7 males and 5 females who agreed to participate in this case series. Average age was 60 years old, from 45 to 80. All of them were diagnosed with osteoarthritis. Some of them just recently, a couple, 2-3 years ago. Others had the condition for 15 or even more years. But most of cases were at an advanced stage. Some of the participants had already been recommended for knee replacements. Some of them had surgeries to try to repair cartilage. We had 1 participant with complete loss of cartilage, which is grade 5, and only 2 participants had more or mild osteoarthritis. Now, in this study, we did not include the following conditions: rheumatoid arthritis, because the treatment for rheumatoid arthritis is quite involved. It's not as simple as just the local treatments. We also not included congenital deformities such as Perthes disease and so on, because again, the treatments are very different. We did not include people with already performed replacements of hip or the knee joint, and also severe heart failure or neurological diseases. The treatments, each participant had a 980 nanometer delta laser, and they performed treatments at home once daily using traumatology 10. So this is the graph on the right. And universal 3 for 3 months, once daily. To monitor the progression of the healing, we used several self-reported outcome measures. First of all, we used the overall assessment of the healing process. Secondly, we asked every day to keep diary, a record of their maximum pain levels. And we also used knee injury and osteoarthritis outcome score, KOOS. It's a questionnaire specifically designed to assess short and long-term outcomes after a knee injury or a knee condition. So using this questionnaire, we can assess 5 different aspects from 0 to 100, which is symptoms, pain, functioning in daily life, sports, and overall quality of life. So each participant had delta laser for 3 months. They did the treatments for 3 months, and after 3 months, this is the overall changes. So we asked them, how much can you rate your improvement after 3 months of chemotherapy? So we had 1 participant who reported no change, 1 participant slightly improved, 1 moderately improved, 7 participants replied much improvement, and 2 substantially improved. And we had no participants who reported fully recovered after 3 months of treatments. So let's look at some details. This graph shows changes in the pain as reported by the knee health questionnaire, the KOOS. Each line represents change from before to after 3 months of treatment. Each green line corresponds to a person with significant change in the knee pain. What you see here is 6 participants had very strong, statistically significant improvement in pain. The green lines are, as you can see, there's still some improvement, but what they say, not significant, statistically significant. And 1 person reported actually worsening of the condition. But when I looked more closely into this case of this red line, this participant actually reported improvement in other KOOS parameters as quality of life. So it's actually very interesting. This person had sports-related injury, or at least he linked his development to the sports injury. But overall, the trend upward is very clear with all these participants. Okay, if you look at the quality of life, these questions report how knee problems, osteoarthritis, influence overall quality of life. Again, we have 6 participants reporting very clear, very significant improvement in the condition. And one here at the bottom, this is 80-year-old lady with osteoarthritis grade 5. Grade 5 is when there is no cartilage left completely. She had reported no changes. 6 other participants, very significant. Okay, to give you an idea of daily progression or what changes participants experience with delta laser, this is a graph of daily pain as recorded by a participant. So the first 35 days, so this level of pain of 35 days, were without delta laser before, this is the baseline. As soon as the lady began chemotherapy, she had immediate and very quite fast improvement in overall pain condition, as you can see. Then over the time there was changes up and down, but overall the trend remained over the next 3 months. So this is the sort of overall progression of the daily pain levels. To conclude this study, we just literally finished processing this data. Overall, we see very good results with 980 nanometer delta laser applied only once daily. And there is room for improvement. Well, first of all, if treatment are not sufficient, 2 or even more treatments per day can be considered. Next, now we also have much more experience with 905 delta laser, and we already know that this delta laser 905 should be applied in the conditions of when there is more severe or more advanced stages of the disease. Also noted that in the condition when there is a lot of other related diseases, a more comprehensive or systemic support should be done with chemotherapy, meaning treatment should be done for other health conditions as well. And also it becomes very clear that a more holistic approach is necessary. And we're talking about here physical exercise, the diet, and also addressing what we call true causes of the disease, or the emotional roots of chronic diseases as well. This concludes this first presentation on knee osteoarthritis.